An infection is the invasion of tissues by pathogens, their multiplication, and the reaction of host tissues to the infectious agent and the toxins they produce. Postoperative infection is an infection that occurs after a surgical procedure, typically within 30 days of surgery or up to a year if an implant is placed. These can be at the surgical site or in other areas of the body. Types of postoperative infections include surgical site infections, or SSIs. These are categorized as superficial, deep incisional, or organ and space SSIs, depending on the affected area. Systemic infections are another type and include sepsis, pneumonia, urinary tract infections, and tuberculosis. Causes and risk factors are divided into 3 categories: patient-related factors, local factors, and microbial factors. Patient-related factors include age, specifically the elderly, malnutrition, obesity, smoking, diabetes, malignancy, immunosuppressive disease, and anemia. Local factors cover contaminated instruments, non-sterile techniques, poor skin preparation, operations on infected organs like a perforated appendix, prolonged surgery, foreign bodies, and inadequate prophylactic antibiotics. Microbial factors involve virulence, bacterial resistance, and prolonged hospitalization. Common gram-positive bacteria pathogens include Staphylococcus aureus, including MRSA, coagulase-negative Staphylococci, Enterococcus, and Group A Streptococcus pyogenes. Common gram-negative bacteria pathogens include Escherichia coli, Pseudomonas aeruginosa, Klebsiella, Proteus, and Acinetobacter baumannii. Anaerobic bacteria include Bacteroides fragilis and Clostridium species. Multi-drug-resistant bacteria include VRE, CRE, and MRSA. Bacteria common in gastrointestinal surgeries include E. coli and B. fragilis. Orthopedic surgeries often involve S. aureus and S. epidermidis. Gynecological surgeries are commonly associated with Enterococcus and E. coli. For cardiothoracic surgeries, S. aureus and P. aeruginosa are common. Neurosurgeries often involve S. epidermidis and Cutibacterium acnes. General symptoms of a postoperative infection include fever, chills, fatigue or malaise, and an increased heart rate. Superficial SSI symptoms include redness, swelling, increased warmth, pain or tenderness around the incision, and drainage of pus or foul-smelling fluid. Deep SSI symptoms involve severe pain, swelling extending beyond the incision, persistent fever, and signs of abscess formation. Organ or space SSI symptoms are specific to the affected organ. For example, abdominal pain or nausea in intra-abdominal infections. Systemic infection symptoms depend on the type, such as pneumonia or UTI symptoms. Local complications of postoperative infection include delayed wound healing, abscess formation, necrosis, and gangrene. Systemic complications include sepsis, septic shock, endocarditis, peritonitis, fistula formation, UTIs, and pneumonia. Initial investigations may include a complete blood count, C-reactive protein, erythrocyte sedimentation rate, blood culture, wound swab culture, and urine culture. An ultrasound abdomen may also be performed. Further investigations may involve tissue biopsy, lumbar puncture, PCR, chest X-ray, CT scan, and MRI. Management includes symptomatic treatment with analgesics, anti-inflammatories, and antipyretics. Fluid replacement for dehydration and nutritional supplements are also important. Antibiotic therapy for superficial infections often involves broad-spectrum antibiotics like cephalosporins or penicillin-based antibiotics. For deep infections or suspected MRSA, vancomycin or clindamycin may be used. Abdominal or pelvic infections require anaerobic coverage, often with metronidazole or clindamycin. Wound care involves cleaning and debriding the wound to remove necrotic tissue. Appropriate dressing application promotes healing and prevents contamination. Topical antibiotics may be used for superficial infections. For deep infections or abscesses, drainage is essential. This can be achieved surgically or through percutaneous methods guided by imaging. Thank you for watching this video on postoperative infection.